Namaste, I'm Dr. Ashutosh Kumar. I'm Clinical Director of Cardiac Electrophysiology working at CARE Hospital, Hyderabad and Bhubaneswar. Today we will be discussing about the cardiac arrhythmia, one of the reasons for the sudden deaths and one of the most reported thing and sensational news which is coming on and off in the media. Let me give the clarity what arrhythmia is. So arrhythmia is a condition in which your heart rate may go fast or slow. When it is going fast, we call as a tachyarrhythmia, and when it is going slow, we call as a bradyarrhythmia. So these are two spectrums of the heart beating related problem, and this can happen to anybody. Means heart beating can go slow when you are sleeping, and when you are walking or running or doing any exertional work, the heart rate will go high. We can say above 100 also. So this type of change of the normal rhythm is not taken as arrhythmia. When the heart beating is going fast or slow, unprovoked and unphysiological, means it is not physiology, means if you are sleeping, your heart rate should go slow. If it is very fast in the night, we will say that it is again a sort of arrhythmia, or we can say inappropriate sinus tachycardia. The same thing, if you are walking, running, your heart rate is not picking up, we say that the heart beating is inappropriate in that situation. But if you are getting heart beating which is very fast and unprovoked, most of the time it is usually seen in the young patient, but it can happen in the child as well as in the elderly, and we call as a paroxysmal supraventricular tachycardia. And regarding this tachycardia, we all should know, because it is one of the most important and one of the most frequent cause of palpitation, unprovoked palpitation. Means you are sitting and all of a sudden your heart rate has gone to 150, 160, you become uncomfortable, you are feeling of doom is coming. So this type of sensation or this type of symptoms are symptoms of paroxysmal supraventricular tachycardia, and this is one of the curable conditions, because patients are not knowing, they are not able to opt the treatment. And whenever this arrhythmia like conditions come, or when anybody is suspecting, it is the cardiologists who are working in the electrophysiology domain, which we call as the electrophysiologists. They will be better able to deal the situation, and they can solve the problem also, because we practice in the electrical domain of the heart. So heart beating is going very fast, very slow. We try to know the reason. We rectify by giving the medicines, and most of the time when it is a curable, we give the electrical therapy, which we call as a EP study RF ablation. Means we study the electrical circuit of the heart and we ablate the abnormal circuit which is causing the palpitation like conditions. So this is all nutshell regarding the arrhythmia, means regarding the tachyarrhythmias. When the heart rhythm is coming from the lower chamber, which we call as a ventricular tachycardia, the heart rate will be very fast and heart stops also, and this is one of the cause for sudden death. So when you are seeing in and around somebody suddenly dying within seconds or minutes, it is the cause, because arrhythmia or ventricular tachycardia, ventricular fibrillation is one of the important condition of sudden death, and this is the reason for the cardiac arrest. Means heart will stop beating if it is prolonged. If the person is getting ventricular tachycardia for some time, the heart will stop beating and the blood pressure will drop, and brain will not receive the nourishment, what we call as a glucose and oxygen, and it will stop working. So person become unconscious and he can die also if it is prolonged. And for that we are having the treatment we call as a EP study RF ablation one time. Sometime we give the devices like ICDs, implantable cardiac defibrillator, which is going to detect the rhythm problem if it is originating, and it gives the therapy and correct the patient. So patient who is becoming on and off unconscious, they will not become unconscious because the beating has been taken care by the ICDs. So this is all about the high heart rate. But when the heart rate is going low, we give the other type of therapy we call as the pacemakers, and pacemaker is implanted at every nook and corner in all over. But ICD and CRTs are the higher procedure, or we call it the devices for the rhythm problem, and these are the devices in which we detect the rhythm and we correct it by the device. And if it is the rhythm problem is coming on and off, then we have to do the EP study and RF ablation to treat it and cure it in some conditions. And Supraventricular paroxysmal supraventricular tachycardia is one condition where it is curable. So it is a proud moment for us because we resumed our EP study RF ablation procedure in this center after a long gap of 2 years when there was a gap due to the corona. It has been resumed and we have completed a milestone of around 100 cases we have done over a course of around 12 to 14 months. So, and in that it is not only the basic cases or we can say conventional procedures, we have done the advanced procedure like 3D mapping and ablation, which is around 30% cases are of that, means there are complex arrhythmias for which the patient may have to go to out of the city or you have to go into metros to avail that services, but we have provided those services in CARE Bhubaneswar and we are able to cure those conditions and patients got the benefit by being conducted in their own city. And some of the cases has been done in the government sponsored program of schemes of BSKY also. So it is a great win for the native of Odisha that they are able to avail the most advanced treatment at CARE Bhubaneswar.
दर्शक बंधु बिना अपॉइंटमेंट रे सबु रोगर सफल उपचार जानिबा पई हेले एबे ही सब्सक्राइब करंतु हमर YouTube चैनल प्रिकॉशन फॉर हेल्थ आ बेल आइकन क्लिक कला फल रे आपण हेल्थ रिलेटेड वीडियो सहित रहिबे अपडेट।